Welcome to the Deep Dive, everyone. Today we're going deep on child psychopathology. It's a field that's more complex and honestly a lot more fascinating than most people realize.
I agree.
We've got a ton of research, both from academic journals and books, and also insights from clinicians and experts in the field to dive into today. So get ready.
Yeah, should be a good one.
Yeah, I think so too. I mean, one thing that really blew my mind while prepping for this, did you know that for a while there, like way back when, doctors actually thought that some kids with cerebral palsy had epilepsy instead? Like, our understanding of all this has come such a long way. And we're going to explore that evolution today, and also the surprising role that genetics plays.
Yeah, it really is amazing how much our perspective on all of this has changed, even like just in the last few decades.
Right.
And the connections between like what seem like completely separate disorders. It's truly
It
fascinating.
really is. Okay, so let's just jump right in.
Sounds good.
The first big challenge when we talk about child psychopathology, really one of the first things that we need to tackle, is diagnosis.
Yeah.
How do we figure out what's actually going on with a kid who's having some kind of behavioral issue? It's not like we can just give them a blood test or something.
Right. Yeah, absolutely not. It's not a simple process at all. And actually, one of the biggest takeaways that I had from reading all this research is how careful we have to be about labeling kids. It's not just about like sticking a kid in a box and saying, okay, well, you have this disorder. That's it. You're done.
Right.
Development, family dynamics, cultural differences, all of those things play a huge role.
So what you're saying is what's normal in one family
Mhm.
might be a total red flag in another.
Exactly.
Yeah.
Yeah. And imagine like the impact of labeling a child, with a diagnosis. That's based on research that doesn't even reflect their culture or their background. We really need to be thinking about a much more inclusive approach to diagnosis.
Right. It's like we need a whole new set of tools, not just a bigger magnifying glass to see the same things.
Yeah. Yeah. Totally. And also, we have to remember that a lot of times kids don't fit neatly into just one category.
Right.
Comorbidity, which is the presence of multiple disorders at once, is so common in kids.
Oh, yeah, for sure.
Yeah, lots to think about there.
Lots to think about. Okay. So we've got this whole, knot of influences, right?
Right.
Where do genes fit into this? The research that I read about schizophrenia was really eye-opening. Adopted kids of schizophrenic mothers, they have a way higher chance of developing the disorder, even if they've never even met their biomom.
Yeah. That really shows you the power of genetic predisposition, right?
Yeah.
But it's not a guarantee, obviously, and that's where twin studies come in.
Right.
So you can compare identical twins who share 100% of their genes with fraternal twins who share about 50%. And by looking at, how similar or different they are in terms of certain traits or disorders, researchers can sort of tease apart the influences of genes and environment.
So it's like nature and nurture are like having this tug of war.
Yeah, in a way. And what's so fascinating about that is that the strength of each pole, like nature versus nurture, can actually change over time.
Oh, really? Okay.
Yeah. So take IQ, for example.
Okay.
Its heritability actually goes up as we get older.
Wait, so you're telling me genes become more influential on IQ as we age? I would have thought it'd be the other way around.
Right. Yeah, it's counterintuitive.
But why would that be?
Well, it probably has to do with the choices we make as we gain more independence, right? So our genes might predispose us to certain interests or abilities, but it's our environment that gives us, opportunities to actually develop those things.
So a kid who has a genetic knack for math, they might not excel if they don't have access to good teachers or challenging coursework.
Exactly. Yeah, they're not going to reach their full potential if they don't have the right environment. And actually, twin studies also help us understand comorbidity, like the stuff we were talking about before.
Okay.
So, ADHD, oppositional defiant disorder, conduct disorder, these often all kind of cluster together. And studies have shown that shared genetic factors play a pretty big role in that.
So even if a child inherits this predisposition for certain challenges, it doesn't automatically mean they're destined for a specific outcome.
Right.
It's more I don't know, having a certain set of starting blocks.
Yeah.
That might make some paths easier or harder to follow.
I like that. That's a good analogy.
Yeah. Okay, so we've talked a bit about genes, but are you ready for a little historical context here?
I'm always up for a history lesson.
I love a good origin story.
Yep.
It's amazing how much our understanding of child psychopathology has evolved over the years. Like I was reading about this guy, Dr. Heinrich Hoffmann.
Hmm.
He wrote this children's book back in the 1800s called Der Struwwel Peter, and he had this character in it, Fidgety Philip, who was like basically the poster child for what we now call ADHD.
Oh, wow.
I know, right? It's amazing to see how those like early observations, even in literature, kind of pave the way for like the modern diagnoses we have today.
Yeah, it really shows how much careful observation and even things like literature contributed to this field. And back then, like doctors like Freud were really just starting to classify subtypes of cerebral palsy and linking them to other conditions.
And then in the 1960s, medical science just like took off. We started to understand the neurochemical basis of a lot of these disorders, and that led to this whole new model of psychiatry, the neurobiological model.
Yeah, it was a huge shift. Suddenly we could see these connections between brain chemistry and behavior, like in a way we never could before.
And that paved the way for new treatments.
Totally.
I was reading about Dr. Warren A. Weinberg. He was a real pioneer in pediatric neuropsychiatry. He started using these new medications to treat things like depression and mania in kids, affective disorders.
Yeah, he really pushed the boundaries of the field. It's amazing to think about how far we've come from, Freud's theories to modern neurobiology, but there's still so much more to learn, of course.
Oh, for sure. So much more to learn.
Yeah.
Okay, so we've talked about genes, we've talked about brain chemistry, but what about how kids actually learn? How does that play into their behavior?
That's a really important question, and I think a good place to start is with the concept of operant
Oh,
conditioning.
operant conditioning.
So this is basically the idea that behavior is shaped by reinforcement, both positive and negative.
So rewards and punishments.
Right. But it can be a lot more subtle than that, too. Like, take Patterson's negative coercion theory, for example.
Sure.
So let's say there's this girl who's, arguing with her mother,
Okay.
and she raises her voice, and then her mother stops lecturing her.
Okay, so she's learned that yelling gets her way.
Right. Exactly. It's negative reinforcement. So her behavior, the yelling, is strengthened because it removes something unpleasant, which is her mom's lecture.
So even these seemingly small communication patterns within a family can actually contribute to bigger issues like, I don't know, like conduct disorder or mood disorders.
Absolutely, yeah. But it's not just about behavior either, right? A child's thought processes, the way they interpret the world, that plays a huge role too.
So if a kid consistently sees things negatively, that could become like a self-fulfilling prophecy almost.
Yeah, exactly. And that's where this idea of irrational beliefs comes into play. So these are distorted ways of thinking. Like one category is demandingness.
Okay.
So that's kind of thinking in musts and shoulds.
Oh, like I must get an A on this test or I'm a total failure, like that.
Exactly. Yeah. Or another category is what's called awfulizing, which is kind of like blowing things way out of proportion. Like if a child fails one test and then thinks, oh, I'll never get into college.
Oh, gosh, yeah. And these negative thought patterns, they can actually feed into conditions like depression.
Right. So depressed kids tend to focus on the negative and then kind of downplay anything positive.
Right. So it's really important to understand both behavior and thought processes to really understand child psychopathology.
Yeah, no, that makes total sense. Okay, but we've been kind of focusing on the individual child here. What about the bigger picture, the social and environmental factors that are at play here?
That's a really crucial piece of this puzzle.
Yeah.
And the sociological perspective on child psychopathology really emphasizes the impact of social disadvantage. Think about, poverty or lack of access to good education, living in an unsafe neighborhood. All of these things create an environment that puts kids at greater risk for mental health problems.
Yeah, it's like some kids are starting this race, a few steps behind, and then we wonder why they're not keeping up. Exactly. And there's this model called the transactional ecological model, which basically says that individual development is intertwined with all these layers of the environment, the family, the school, the community, even the culture.
So it's not just about fixing the problem child. It's about understanding and addressing the whole system that they're in.
Right. And there are a couple of important concepts here, like social exposure, which means the types and intensity of risks a child faces, and social vulnerability, which is how susceptible they are to those risks based on their circumstances.
Okay, so, for example, a child living in poverty, they might be exposed to more violence or have less access to health care, which then makes them more vulnerable to developing mental health problems.
Precisely. And there's another layer to this, the idea of multiplexity of social status.
Okay.
So this means that a child's experience is shaped by being part of all these different social groups, their race, gender, socioeconomic status, and so on.
So interventions can't just be this one-size-fits-all thing. They have to consider this whole web of influences, right?
Exactly. Interventions need to be tailored to the child's specific circumstances.
That makes a lot of sense. Wow. I'm really starting to see how all these pieces fit together. So we've got genes, environment, how a child learns. What about their inherent personality? Do some kids just kind of come pre-wired for certain challenges?
You're talking about temperament, and that definitely plays a huge role. Think about how some babies are super chill and laid back, while others are like easily startled or fussy.
Yeah.
These inborn tendencies, they can really impact a child's development.
So you're saying that these early personality traits could actually increase the risk of developing certain disorders down the line.
Yeah, that's the idea. There's a theory of temperament called Rothbard's theory that highlights different dimensions of temperament. Like one is effortful control, which is the ability to inhibit impulses and stay focused on goals. And this actually emerges around a child's first birthday and continues to develop throughout childhood.
So a kid with low effortful control might struggle with things like sitting still, following directions, resisting temptation. All those things that can make school and social life really tough.
Exactly. And it's fascinating because there may even be like a physiological component to this. Researchers have been looking at something called EEG asymmetry, which basically measures brain activity, and it can actually reflect individual differences in emotionality.
Wait, hold on. You're telling me we can see different emotional wiring in the brain?
Well, in a way, yeah. They did this study where they looked at infants' reactions to being separated from their mothers.
Okay.
And the infants who showed less left-sided brain activation, they were actually more likely to cry when they were separated, which suggests they might be more emotionally sensitive.
So maybe there's a biological marker for traits like emotional sensitivity or reactivity.
Yeah, that's what researchers are exploring. It could have huge implications for how we understand and support kids, like from a very young age.
Yeah, that's amazing.
And it doesn't stop there. They've also extended this research to look at like behaviorally inhibited and uninhibited children. And they're finding possible links between brain activity, temperament, and even social behavior later on.
This is all blowing my mind. It's like this constant dance between nature and nurture.
Yeah, it's super complex.
And brain activity is like playing this key role.
Absolutely. And speaking of early development, we have to talk about infant mental health, which is about way more than just the absence of problems.
So what does a mentally healthy infant look like?
It's about their capacity to experience and regulate and express emotions, to form secure relationships, and to kind of like explore their world.
Okay, that makes sense. It sounds like the foundation for a healthy life.
Yeah.
But how much of that is like hardwired and how much depends on their environment?
That's the big question, isn't it?
Yeah.
But we do know that the caregiving environment is absolutely crucial. Family, community, culture, all of that contributes to an infant's mental health.
So even in those first few years, the environment can really have a profound impact on a child's emotional development.
Absolutely. And that's why assessing and intervening early is so important.
Yeah.
You have to take into account both the child's development and the relationship context.
So it's not just about looking at the baby, but also their relationships, especially with their primary caregivers.
Exactly. And one common approach is what's called dyadic therapy, where the parent and the child are actually seen together.
So strengthening the bond between parent and child becomes part of the treatment.
Right.
Wow, this is so interesting. Okay, we've covered a lot of ground already. Genes, environment, temperament, the importance of early intervention. It's a lot to process.
It is. And the good news is there's a whole framework that can help us make sense of all of this. Developmental psychopathology.
Okay, break that down for me. What is developmental psychopathology exactly?
So it's a way of understanding how mental health problems emerge and evolve over time. And it goes beyond just labeling behaviors as normal or disordered. It focuses on the dynamic processes of development.
So it's like taking a long-term perspective,
Yeah.
recognizing that mental health isn't static, it's more like a journey.
Yeah. And it emphasizes what are called transactional models,
Okay.
which highlights how the child and their environment are constantly influencing each other.
So it's that two-way street again. The child shapes their environment, and the environment shapes the child.
Exactly. And for a really powerful example of this, let's look at childhood maltreatment.
Okay.
Research has shown that it can actually lead to a whole cascade of difficulties across development.
Yeah.
From problems with emotional regulation in infancy to social and academic struggles in childhood, even to mental health issues in adulthood.
Gosh, that's really heartbreaking.
It is. It shows how those early experiences can have a ripple effect throughout a person's life.
But
So the key takeaway here is that understanding these pathways of development, both typical and atypical, is crucial for coming up with effective interventions. We need to know how things unfold over time to really create strategies that work.
yeah, it's about recognizing that mental health issues don't just like appear out of thin air.
Right.
They develop within a context,
Yeah.
a story that begins way before any symptoms are even visible.
Exactly. So are you ready to dive into some specific childhood disorders now?
I think my brain needs a minute to catch its breath. There's so much to unpack here, but it's also fascinating. We've laid this amazing foundation, and I can't wait to explore those specific disorders in more depth.
Sounds good. We'll take a pause here and come back to explore those disorders in part two. Welcome back. Are you ready to delve into the world of specific childhood disorders?
Absolutely. We've laid the groundwork. Now let's get into the specifics. Where should we start?
Well, why don't we begin with something that honestly a lot of people experience at some point in their lives, and that's anxiety. Specifically, generalized anxiety disorder, or GAD. You might be surprised to learn that this isn't just an adult thing.
So we're talking about like more than just typical childhood worries, like a kid who's nervous about a test or the first day of school.
Right, yeah. GAD is different. It's more like imagine a child who's constantly on edge, worrying excessively about everyday things. Their worries are like way out of proportion to the situation, and it starts to affect their life in all these different areas. Schoolwork, friendships, even their sleep. It can all suffer.
Yeah, I can see how that would be really debilitating. The research mentioned how the diagnostic criteria for GAD have actually evolved over time. It used to be called over-anxious disorder. What prompted that shift?
Well, there's been this like ongoing debate about whether it's really a distinct disorder or just like an extreme form of normal childhood anxiety.
Yeah.
The change to GA and the DSM, the Diagnostic and Statistical Manual of Mental Disorders, that really helped researchers study it more effectively.
Okay.
And it led to a better understanding of like the unique features of GAD.
So what makes a child more susceptible to developing GAD? Is it purely genetic, or are there other factors at play?
It's definitely a mix, like most things in mental health.
Right.
Research shows that children of anxious adults are more likely to experience anxiety themselves, so that suggests there's at least some hereditary component.
Right.
But it's not as simple as, like, inheriting an anxiety gene or anything.
So if a parent has GAD, their child isn't automatically doomed to have it too.
Exactly. A child's personality also plays a big role. Like, for example, kids who are naturally more inhibited or prone to negative emotions, they might be more vulnerable to GAD. And then, of course, stressful life events like, family conflicts or academic pressures, those can contribute as well.
It sounds like understanding GAD in kids requires like a really holistic view, taking into account their biology, their personality, and their environment.
Absolutely, yeah. And the good news is that early intervention can make a huge difference. The earlier we can identify and address these, like, anxious patterns, the better the chances of preventing more serious problems down the road.
Okay, that makes sense. So we got GAD, which is kind of like this pervasive general worry. What about social anxiety? Is that just like extreme shyness, or is there something more to it?
Well, shyness is definitely common, but social anxiety disorder, or SAD, is a lot more intense than that. It involves this really significant fear of social situations, and that can lead to a lot of avoidance behaviors.
So we're not just talking about feeling awkward at a party. This is something that can really interfere with a child's life, right?
Exactly. Imagine a child who just dreads going to school because they're terrified of being called on in class, or they avoid birthday parties because they're just so afraid of interacting with other kids. It can be incredibly isolating and really get in the way of them living a full life.
The research I read pointed to a strong link between SAD and certain personality traits, particularly introversion and neuroticism. Does that mean if you have those traits, you're automatically going to have social anxiety?
Not necessarily. It's more about predisposition, I think. Children who are naturally more introverted or prone to anxiety, they might be more susceptible to developing SAD, especially if they've had some negative social interactions or if there's a family history of anxiety.
So it's that combination of nature and nurture again, and this can
Yeah.
have a real impact on their development, right?
Yeah.
Especially in terms of like social skills and building relationships.
Oh, absolutely. Children with SAD often miss out on opportunities to practice those social skills and build friendships, which is so important during those developmental years. And unfortunately, the research suggests that if it's not addressed early on, SAD can become a really chronic problem. Like, it can persist into adulthood.
Wow. That's a pretty compelling reason to take childhood anxiety seriously.
Yeah.
Okay, speaking of serious, let's talk about post-traumatic stress disorder, or PTSD. I
Hmm.
always thought of that as something that affects, like, soldiers or victims of some huge trauma.
Well, while PTSD is often associated with those experiences, it's important to remember that children can develop PTSD after any event that they perceive as traumatic, even if it's something that might seem less severe to an adult.
So what kind of events could trigger PTSD in a child?
It could really be anything, from a car accident or a natural disaster to witnessing violence or experiencing abuse. Even something like a medical procedure or the sudden loss of a loved one can be traumatic for a child, depending on their age and how they process it.
So it's really about how the child interprets the event, not just the objective severity of it.
Exactly. And it's important to understand that not everyone who's exposed to trauma develops PTSD. A child's individual resilience, their support system, and even their personality can influence how they respond.
The research mentioned how extroversion and neuroticism might play a role in how a child copes with trauma. How does that work?
Well, think about it. An extroverted child might naturally seek out social support after a trauma, which can be incredibly protective. On the other hand, a child who's high in neuroticism, who's already kind of prone to negative emotions, they might struggle more with anxiety and fear after a traumatic event.
It's like those personality traits can either buffer or amplify the impact of the trauma.
That's a good way to put it. And the way a child processes the traumatic event can also have a lasting impact on their personality development. It can affect their trust in others, their sense of safety in the world, even their core beliefs about themselves.
So PTSD can really shape a child's entire worldview.
In a way, yeah. It can lead to changes in their behavior, their emotional regulation, their relationships, all sorts of things. But with the right support, children can heal and they can thrive. It doesn't have to define them forever.
That's good to hear. What are some of the most effective treatments for childhood PTSD?
Well, trauma-focused cognitive behavioral therapy, or TFCBT, has a really strong track record. It basically helps children process their trauma, develop coping mechanisms, and challenge those negative thoughts and beliefs that can keep them stuck.
So it's about giving them the tools to understand and manage their reactions to those traumatic memories.
Exactly. And in some cases, medication might be used in conjunction with therapy to target specific symptoms, like anxiety or sleep problems or flashbacks.
It sounds like taking a multifaceted approach is really important, addressing both the emotional and physiological impacts of trauma. Now let's shift gears a bit and talk about mood disorders, specifically major depression, or MDD. I know this is a serious condition in adults, but what does it look like in children?
It can be a little harder to recognize because children don't always express their feelings in the same way that adults do. So instead of sadness, you might see more irritability, withdrawal, or even physical complaints like stomach aches or headaches.
So it's not always that classic picture of sadness and crying that we associate with depression.
Right. And it's important to note that while depression can affect children of any age, the symptoms might look different depending on their developmental stage. Like, a preschooler with depression might be really clingy and have trouble separating from their parents, but a teenager with depression might become more rebellious or isolate themselves from friends and family.
It's so important for parents and teachers to be aware of those developmental differences,
Yeah,
right?
sure.
They can't just dismiss changes in behavior as oh, that's just typical for a 4-year-old, or that's just teenage angst.
I totally agree. And the research actually highlighted a really interesting finding. While the specific depressive symptoms might change over time, the overall pattern of depression tends to stay relatively stable.
So even if the outward expression of it shifts, the underlying experience of depression kind of persists.
Exactly. Which really points to the importance of early intervention. Addressing those core patterns can help prevent depression from becoming a chronic problem.
What about the causes of MDD in children? Is it purely biological, or are there other factors involved?
Like most mental health disorders, it's this complex interplay of genetics and environment. Twin studies have shown that there's definitely a heritable component to depression, but that doesn't mean it's predetermined.
So genes might increase the risk, but they don't seal the deal.
Exactly. Environmental factors like stressful life events, family dynamics, and even a child's thinking patterns can play a huge role. For example, the cognitive model of depression suggests that negative thinking patterns can both contribute to and maintain depression.
It's like getting caught in this loop of negative thoughts that just keep feeding the depression.
Right. And research has also shown that certain parenting styles, like those high in psychological control and rejection, are associated with an increased risk of depression in kids.
So the family environment can have a big impact on a child's mood and well-being.
Absolutely. And we also need to be aware of comorbidity, as always. Anxiety and disruptive disorders, like ADHD and ODD, are very common in children who have MDD.
So it's not always a straightforward diagnosis. There might be multiple layers to unravel.
Exactly. Now let's talk about a mood disorder that can be particularly challenging to diagnose and treat. Bipolar disorder.
I know bipolar disorder involves those like extreme shifts in mood, going from mania to depression. But how does that actually present in children? Is it the same as in adults?
That's the tricky part. Diagnosing bipolar disorder in children is complex because some of the symptoms can overlap with other disorders like ADHD.
So like a child who's hyperactive and impulsive and has mood swings. How do you know if it's ADHD or bipolar disorder or both?
It takes a really careful and thorough evaluation, taking into account the child's developmental stage, family history, and the specific pattern of symptoms. And there's been some controversy about the possibility of overdiagnosis of bipolar disorder in children, which makes it even more important to get a comprehensive assessment from a qualified professional.
So it's not a diagnosis to be taken lightly. What about the causes? Do we know what makes a child more likely to develop bipolar disorder?
Well, like depression, it's believed to be a combination of genetic and environmental factors. The heritability of bipolar disorder is actually quite high, but environmental triggers like stress or trauma can also play a role.
The balance of nature and nurture again. And treating bipolar disorder in children, I imagine that comes with its own set of challenges.
You're right, finding the right medication can be a real process of trial and error. And you have to monitor really closely for potential side effects, which can sometimes be more severe in children.
So it's a delicate balancing act.
It is, and therapy is a vital component of treatment. It can help children manage their symptoms, develop coping mechanisms, and just overall improve their quality of life. Family therapy is often really important as well to support the whole family system in navigating the challenges of bipolar disorder.
Yeah, takes a village, right? Okay, let's move on to a different kind of challenge. Intellectual disability, or ID. I know this used to be called mental retardation, but the terminology has evolved, thankfully.
Yes, language matters. And we want to use respectful and accurate terms. Intellectual disability involves significant limitations in both intellectual functioning and adaptive behavior. Things like communication, social skills, and daily living skills. This can affect a person's ability to learn, to solve problems, and to function independently.
And the severity can range quite a bit, right?
Absolutely. It can range from mild to profound. And the causes are really diverse, ranging from genetic syndromes to prenatal exposures to toxins to birth complications or even childhood illnesses or injuries.
Wow, it sounds like anything that disrupts brain development can potentially lead to ID.
That's a good way to put it. And there's a really interesting developmental approach to understanding ID put forth by a researcher named Ziegler. He really emphasized the role of motivational factors, particularly a concept called outer directedness.
Okay, what is outer directedness? That sounds kind of complicated.
It's actually pretty simple. It's the tendency to rely on external cues for guidance, to look to others for direction. Ziegler suggested that individuals with ID might develop this as a way to compensate for their cognitive limitations.
So like, if they're struggling to process information or make decisions on their own, they might look to other people for help.
Exactly. And he also highlighted how individuals with ID might develop certain maladaptive personality traits due to repeated experiences of failure and social rejection. Imagine growing up constantly being told, you're not good enough, or you can't do it. That can really take a toll on your self-esteem and shape the way you interact with the world.
Yeah, I can see how that would be really damaging. It emphasizes the importance of creating supportive environments for individuals with ID. Environments where they feel a sense of competence and belonging. We need to celebrate their strengths and give them opportunities to succeed.
I completely agree. And this actually reminds me of autism spectrum disorder, or ASD, which used to be grouped under the broader category of pervasive developmental disorders, or PDDs.
Right, I remember hearing that the term pervasive developmental disorders isn't really used anymore. What prompted that shift?
Well, it's part of this ongoing effort to refine our understanding and classification of developmental disorders. Autism spectrum disorder is now the umbrella term for a group of neurodevelopmental disorders that affect social interaction, communication, and behavior.
And it's a spectrum, which means there's a huge range in the severity of symptoms, right?
Exactly. Some children with ASD might be nonverbal and have significant challenges with daily living skills, while others might be highly verbal and academically gifted, but still struggle with social interactions and rigid thinking patterns.
So it's not a one-size-fits-all diagnosis. Every child with ASD has their own unique strengths and challenges.
Absolutely. And one area that's often affected is play. Children with ASD might engage in like repetitive or sensory motor play, and they often have difficulty with pretend play, which is so important for developing social skills and imagination.
The research also talked about the impact of ASD on families. It could be really challenging for everyone involved, right?
It can be incredibly demanding. Parents of children with ASD often report higher levels of stress than parents of children with other disabilities. The communication difficulties, behavioral challenges, and often unpredictable nature of ASD can make parenting particularly tough.
So it's really important to provide support and resources to these families, not just focus on the child's individual needs.
Absolutely. And thankfully, there are many effective interventions available, ranging from behavioral therapies like applied behavior analysis or ABA to social skills training and parent support groups.
Yeah, it really does take a village. Okay, let's talk about learning disorders, or LDs. These are those challenges that affect specific academic skills, like reading, writing, or math, right?
That's right. And it's important to remember that these difficulties aren't due to a lack of effort or intelligence. They actually stem from brain-based differences that affect how a child processes information.
Dyslexia is a common example, right?
Exactly. Dyslexia involves difficulty with phonological processing, which is basically the ability to understand and manipulate the sounds of language. This can make reading and spelling particularly challenging, even though the child might be bright and capable in other areas.
It must be so frustrating for those kids, feeling like they're falling behind, even though they're trying their best.
It can be. And LDs can also impact their social relationships. Children with LDs might be teased or excluded because of their academic struggles, which can further erode their confidence.
So it's not just about academic performance, it's about the whole child, their emotional well-being, their social development, their sense of self-worth.
Exactly. And that's why a really comprehensive approach to intervention is so important. It's not just about tutoring or remedial education, it's about addressing the emotional and social impacts as well.
What kinds of interventions are helpful for learning disorders?
Well, educational interventions are key, of course. For example, children with dyslexia often benefit from specialized reading instruction that focuses on phonics and phonemic awareness, which basically means breaking down the sounds of language into smaller chunks.
So it's about tailoring the instruction to their specific learning needs.
Precisely. And sometimes accommodations, like extra time on tests or the use of assistive technology, can help level the playing field a bit.
It's about removing those unnecessary barriers and giving them the tools they need to succeed. Okay, let's move on to a different type of disorder. Oppositional defiant disorder, or ODD. This involves like a pattern of defiant and argumentative, often hostile behavior towards authority figures.
Right. And it's important to distinguish this from, like, typical childhood rebellion. ODD goes beyond just testing limits or having the occasional tantrum. It's this really persistent pattern of negativity, defiance, and disobedience that interferes with the child's relationships and daily life.
So we're talking about more than just a difficult kid. This is a pattern of behavior that's causing some real problems.
Exactly. And what's interesting is that ODD is often considered a precursor to conduct disorder, which is a more serious pattern of antisocial behavior.
So it's kind of like a stepping stone on a pathway towards more serious problems.
In a way, yeah. And that's why early intervention is so crucial. By addressing those defiant behaviors early on, we might be able to prevent them from escalating into more serious conduct problems.
What about the causes of ODD? Is it primarily biological, or do environmental factors play a bigger role?
Like most disorders, it's a complex interplay of nature and nurture. Genetics might contribute to a child's temperament or impulsivity, making them more prone to frustration or anger. But then environmental influences, like harsh or inconsistent parenting, family conflict, even peer influences, can also shape their behavior.
So it's not just about blaming the parents, but recognizing that the child's behavior is influenced by this whole system of factors.
Exactly. And treatment for ODD often involves parent training, which teaches parents more effective discipline strategies and communication skills.
So it's about empowering parents to manage those challenging behaviors and create a more positive home environment.
Right. And sometimes individual therapy for the child can be helpful too, to address any underlying emotional issues or teach them some coping skills for managing their anger and frustration.
It's a multifaceted approach, supporting both the child and the family. Now let's talk about conduct disorder, or CD. This is that more serious and persistent pattern of rule breaking and violating the rights of others that we talked about earlier.
Right. So we're talking about behaviors like aggression, property destruction, theft, deceitfulness, and even cruelty to animals. And it's important to distinguish between childhood onset and adolescent onset subtypes because they have different implications.
So what's the difference between those two subtypes?
Well, children with childhood onset CD, they typically start showing symptoms before the age of 10,
Okay.
and they tend to have a more severe and persistent course. They're at higher risk of continuing these antisocial behaviors into adulthood and developing more serious problems like criminal behavior or substance abuse.
So early intervention is absolutely crucial for this group.
Absolutely. Now, children with adolescent onset CD, they usually start showing symptoms during puberty, and they tend to have a less severe and more time-limited course.
So their behavior might be more influenced by like peer pressure or that typical teenage rebellion phase.
Yeah, that's one possibility. And while their outcomes are generally better than those with childhood onset, it's still important to address those behaviors and provide support, to prevent them from becoming entrenched patterns.
What about the causes of conduct disorder? Is it purely biological or do environmental factors play a bigger role?
It's always a complex mix, as we've been talking about. Genetics might contribute to a child's temperament or impulsivity, but environmental factors like family dysfunction, poverty, exposure to violence, even just peer influences can really shape their behavior.
It's that web of influences again.
Exactly. And treatment for conduct disorder often involves a multi-systemic approach, addressing the child's individual needs, as well as family dynamics, school environment, and peer relationships.
So it's about recognizing that the child's behavior isn't happening in a vacuum. It's embedded within this whole system, and we need to intervene on multiple levels to create lasting change.
Right. Now let's talk about a problem that's particularly relevant to adolescents: substance abuse.
Substance abuse can obviously affect anyone, but adolescence is a particularly vulnerable period, right? Why is that?
Well, the adolescent brain is still developing, particularly the prefrontal cortex, which is the part of the brain that's responsible for things like decision-making, impulse control, and long-term planning.
So they're more likely to make impulsive decisions and engage in risky behavior.
Exactly. And experimenting with drugs or alcohol during this really critical period of brain development can have some serious and long-lasting consequences.
Like what?
It can disrupt the development of those neural pathways, the connections in the brain. It increases the risk of addiction, and it can even lead to cognitive impairments later in life.
So what makes substance abuse in adolescents different from substance abuse in adults? I mean, the substances themselves are the same, right?
The substances might be the same, but the motivations, the patterns of use, and the potential consequences, those can be pretty different. Adolescents often have different reasons for using substances. They might be seeking thrills, trying to fit in with their peers, or even just coping with stress or emotional problems.
So their substance use might be driven more by like social pressures or just a desire to experiment and rebel.
Right. And their patterns of use might be different too. They might be more likely to engage in things like binge drinking or experimental drug use, rather than that chronic daily use that you often see in adults.
Which honestly can be just as dangerous, if not more so, given that their brains and bodies are still developing. What about treatment? How do we effectively address substance abuse in adolescence?
That's a great question. It's really important to recognize that treatment approaches for adolescents need to be developmentally appropriate. Those traditional confrontation of denial approaches that sometimes work for adults, those often backfire with teenagers.
That makes sense.
Yeah.
Teenagers are at this stage where they're like figuring out their identity, pushing boundaries, asserting their independence. So coming down hard on them might just make them more resistant.
Exactly. So effective treatment often focuses more on building motivation for change, developing coping skills, and addressing any underlying emotional or social issues that might be contributing to their substance use.
It's about meeting them where they're at, understanding their perspective, and empowering them to make healthier choices.
Right. Now let's move on to a really serious issue that unfortunately demands our attention: child physical abuse and neglect.
Child maltreatment is a heartbreaking reality. I think it's really important to define what we're talking about here. What are the different forms it can take?
Well, child physical abuse involves any non-accidental physical injury that's inflicted on a child by a caregiver. This could include things like hitting, kicking, burning, shaking, or any other action that causes physical harm.
So it's about intentional acts of violence against a child.
Right. And then there's child neglect, which is kind of the other side of the coin. It involves the failure of a caregiver to provide for a child's basic needs, such as food, shelter, clothing, medical care, or supervision.
So neglect isn't always about intentional harm. It could also be about a caregiver's inability or unwillingness to provide adequate care, maybe because of their own struggles with, I don't know, mental health or substance abuse or poverty or all of the above.
Exactly. And regardless of what form it takes, child maltreatment can have really devastating consequences for a child's development, both in the short term and the long term.
What kind of long-term effects are we talking about? Like, how does this early trauma impact a child's life trajectory?
Well, for starters, it can really disrupt their emotional development, leading to things like attachment difficulties, problems with emotional regulation, and even an increased risk of developing personality disorders later in life.
So those early experiences of abuse or neglect can really shape their entire worldview and their ability to form healthy relationships.
Absolutely, and it doesn't stop there. Child maltreatment can also have a negative impact on their cognitive development, affecting their ability to learn, to focus, to succeed in school.
It's like this really tragic cycle. These early wounds can create a whole cascade of challenges that affect their whole life.
It's true. That's why early identification and intervention are so crucial. We need to protect children from harm and provide support to families who are struggling, whether it's through parent training programs, home visitation services, or in some cases, removing the child from the home to ensure their safety.
It's such a complex issue. There are no easy solutions.
Yeah.
But recognizing the signs of abuse and neglect and taking action to protect children is absolutely paramount. Now, let's talk about another incredibly sensitive and complex issue, child sexual abuse, or CSA. This is a really difficult topic to talk about, but it's something we can't shy away from.
You're absolutely right. It's essential to talk about it openly and honestly without minimizing the harm that it causes. Child sexual abuse is any sexual activity that involves a child and an adult or another child. And it's a violation that can have really profound and long-lasting effects on a child's psychological well-being.
What kind of challenges do children who have experienced CSA often face?
Well, the trauma of sexual abuse can manifest in a lot of different ways. They might develop PTSD, anxiety, depression, or even behavioral problems. They might struggle with trust, with intimacy, with forming healthy relationships.
So it can affect their sense of safety in the world, their self-worth, their ability to navigate relationships, really their whole lives.
Yeah,
And disclosing and reporting child sexual abuse can be incredibly difficult, right?
absolutely. They might be afraid of not being believed, of being blamed, or of the consequences for themselves or their families. And often the perpetrator is someone they know and trust, which makes it even harder to come forward.
So it's really our responsibility as adults to create a safe and supportive environment for children to disclose abuse and to respond to those disclosures with sensitivity and belief.
I couldn't agree more. And if a child does disclose abuse, it's absolutely crucial to get them professional help. Therapy can play a vital role in helping them process the trauma, develop coping mechanisms, and begin to heal.
It's about creating a space where they feel safe and validated and empowered to begin that journey of recovery. Okay, let's shift gears again and talk about somatoform disorders. These are a little less talked about, but still really important to understand.
You're right. Somatoform disorders involve physical symptoms that can't be fully explained by a medical condition. They really highlight that powerful connection between the mind and body. It shows how emotional distress can actually manifest in physical ways.
So we're talking about situations where someone is experiencing very real physical symptoms like pain or fatigue, but there's no identifiable medical cause.
Exactly. And it's important to emphasize that the symptoms are very real and they can cause significant distress and impairment, even though there's no underlying medical explanation that we can find.
What are some examples of somatoform disorders that we might see in children?
Well, one example is conversion disorder, which involves neurological symptoms like paralysis or seizures that can't be explained by any known medical condition.
So like the child might suddenly lose the ability to walk or have a seizure-like episode,
Yeah.
but all the medical tests come back normal.
Exactly. And another common example is pain disorder, where a child experiences persistent and severe pain that's out of proportion to any physical injury or medical condition.
These disorders must be incredibly challenging to diagnose and treat. How do you even begin to approach something like that?
It's a multi-step process. First, it's essential to rule out any potential underlying medical conditions. This might involve a whole battery of medical tests and consultations with specialists.
So you want to be absolutely sure that there's not an actual physical cause for the symptoms before you explore the psychological component.
Exactly. Once medical causes have been ruled out, then the focus shifts to addressing the psychological factors that might be contributing to those symptoms, and that's where therapy comes in.
What kind of therapy is helpful for somatoform disorders?
Well, cognitive behavioral therapy, or CBT, is often really effective. It can help the child manage stress, cope with emotional distress, and develop healthier ways of responding to physical sensations.
So it's about helping them understand that mind-body connection and regain a sense of control over their symptoms.
Right. And sometimes family therapy can be helpful too, to address any family dynamics or communication patterns that might be contributing to the child's stress or anxiety. It's about taking a holistic approach, recognizing that mind and body are intricately connected.
Wow, we've covered so much ground today. We've explored a whole range of childhood disorders, from anxiety and depression to conduct problems, and even these somatoform disorders. It's clear that child psychopathology is a vast and complex field.
It really is. And honestly, we've only just scratched the surface. There's so much more to learn and discover about the intricate workings of the developing mind. But hopefully this deep dive has given you a better understanding of some of the challenges that children might face and the different approaches that we can use to support their well-being.
I feel like I've learned so much already, but I know there's one more piece to this puzzle treatment. Now that we've explored all these specific disorders, I'm really curious to dive into the different approaches that are used to actually help children who are struggling.
That's a great segue. We've talked a little bit about the importance of early intervention and some specific therapies along the way, but in the next part, we'll delve into the broader landscape of treatment approaches in child psychopathology. Welcome back to the deep dive.
Okay, so we've explored like a whole spectrum of childhood disorders in detail, and it's pretty clear there's no one-size-fits-all solution here.
Right.
So what are some of the main treatment approaches that are used in child psychopathology? Where do we even begin when a child is struggling?
Yeah, you're right. It's not like we're looking for a magic wand, that'll just fix everything.
Yeah.
It's more like having this toolbox filled with different approaches and really understanding like when to use which tool. And I think a good place to start might be with like a classic psychodynamic therapy.
Psychodynamic therapy.
Yeah.
Okay, so that's the one that kind of delves into the unconscious, right? Like uncovering these deep-seated conflicts and patterns that might be driving a child's behavior.
Yeah.
But how do you even do that with a kid?
Yeah, it's not like you're going to put them on a couch and be like, okay, tell me about your mother.
Right.
With children, play therapy is a common form of psychodynamic therapy.
Ah, okay. That makes a lot more sense. Using like toys and games to help them kind of express themselves, like speaking their language.
Exactly, yeah. Play is just this natural way for children to communicate their feelings and work through conflicts and even practice new ways of coping. And the therapist's role is really to kind of observe and interpret and gently guide the child through that process.
So it's not just like letting them run wild with the toys. There's like a real strategy behind it.
Oh, yeah, absolutely. The therapist is helping the child make those connections between what's happening in the play therapy session and what's happening in their real life.
Okay.
And that helps them gain insight into, those deeper emotional patterns that might be at play.
Psychodynamic therapy has been around for a long time. But what about its effectiveness? Like, is there actual scientific evidence to support it, especially when it comes to kids?
That's where things get a little tricky. The research on psychodynamic therapy is kind of mixed. Some studies have shown some positive results, especially for what are called internalizing disorders like anxiety and depression, where understanding those deeper emotional patterns can be really helpful.
Okay.
But yeah, the evidence isn't as strong as it is for some other therapies.
So it might not be a quick fix, but it could still be valuable for, certain kids and certain challenges.
Exactly. It's about choosing the right tool for the job.
Right.
It's important to consider like the individual child's needs and what they're struggling with, rather than assuming that one approach is going to work for everybody.
Makes sense.
Now, let's talk about a therapy that actually has a much stronger evidence base, especially for children, and that's cognitive behavioral therapy, or CBT.
Oh, yeah, CBT. I've heard a lot about that being effective for adults. Does it work for kids too?
Oh, it totally does. It's actually one of the most widely used and empirically supported therapies for kids and teens. There are tons of studies that have shown that it's effective in treating a whole range of mental health problems: anxiety, depression, OCD, even trauma.
Okay, so CBT has, like, science on its side.
It does.
But what's the basic idea behind it? Like, how does it actually work?
So CBT focuses on the connection between thoughts, feelings, and behaviors. The core idea is that our thoughts influence our feelings, which then influence our actions.
Okay, so like if you have a negative thought, that can lead to negative feelings, which might then lead to some unhelpful behaviors.
Exactly. And so CBT basically helps children identify and challenge those negative or those distorted thoughts
That,
and replace them with ones that are more balanced and realistic.
so it's like teaching them to become aware of their own thought patterns and then
Yeah.
develop some healthier ways of thinking.
Exactly. But it goes beyond just thinking, too.
Yeah.
CBT also involves developing coping skills for managing those difficult emotions and changing those unhelpful behaviors.
Can you give me like an example of what that might look like in practice?
Sure. Let's say there's a child with social anxiety,
Okay,
and they have this thought, everyone is going to laugh at me if I have to give a presentation in
right.
class.
A very common fear.
Right. So CBT would help them to kind of challenge that thought. Like, is there any actual evidence to support that thought? You know, what's a more balanced way of looking at this situation?
So instead of catastrophizing, they might learn to think something like, okay, well, maybe some people won't be that interested, but that's fine. I can just focus on the people who are engaged.
Right. And they might also practice some coping skills like deep breathing or positive self-talk to help them manage their anxiety during that presentation.
That sounds really practical.
It
And
is.
empowering, giving kids these concrete tools that they can use to manage those challenges.
Yeah, that's one of the great things about CBT. It's very skill-based.
Right.
It involves a lot of practice, which helps kids, generalize those skills to real-life situations.
Awesome. So we've got psychodynamic therapy, we've got CBT, and then what about pharmacological treatments?
Yeah, so medication.
That can be kind of a controversial topic, especially when we're talking about kids.
Yeah, it is. It's definitely something that requires careful consideration and close collaboration with a qualified medical professional.
Right.
But medication can play a really important role in managing certain childhood disorders, often in conjunction with therapy.
Okay, so it's not always an either or thing.
Right.
Medication and therapy can actually work together to kind of support a child's well-being.
Exactly. And for some disorders like ADHD or bipolar disorder, medication can be really essential for stabilizing mood, improving focus, reducing impulsive behaviors, and that allows the child to actually benefit more fully from therapy.
Yeah, that makes sense. It's like they need that foundation of stability before they can really engage in the therapeutic process.
Right.
So what are some of the most common types of medications that are used with kids?
Well, it really depends on the specific disorder. So for ADHD, stimulants are often prescribed to help improve attention and reduce hyperactivity. For depression, antidepressants might be used to help regulate mood. And then for bipolar disorder, mood stabilizers or antipsychotics might be prescribed to manage those extreme shifts in mood and behavior.
And I think it's important to remember that any decision about medication, for a child especially, should always be made in close consultation with a doctor.
Absolutely.
They're the experts on the potential benefits and risks.
Yeah, they can really help weigh those things. Careful evaluation, monitoring, open communication between the doctor, the child, and the family, that's all essential to making sure the treatment is safe and effective.
For sure. Now, while psychodynamic therapy, CBT, and medication are some of the most common approaches, there are a lot of other therapies out there that can be really helpful for kids too, right?
Oh, tons.
Like what?
Well, family therapy is often really crucial, especially when family dynamics are playing a role in a child's difficulties. You know, it can help improve communication, resolve conflicts, strengthen those supportive relationships within the family.
Right. Sometimes the whole family needs support, not just the child.
Exactly. And there are also a lot of creative therapies out there, like art therapy and music therapy, which can be really powerful outlets for kids to express themselves, process their emotions, and even develop coping skills.
Oh, those sound amazing,
Yeah,
especially for those kids who might have a hard time, putting their feelings into words.
exactly. And then there's also animal-assisted therapy, which has actually been shown to have some incredible benefits for kids with a range of challenges, from reducing anxiety and stress to even improving social skills and communication.
Wow, there's so much out there.
There really is.
The field of child psychopathology is so vast and constantly evolving.
It is. It's a very exciting time to be working in this field as we continue to learn more about the developing brain, the interplay of nature and nurture, and really just the most effective ways to support children's mental health.
So as we wrap up this deep dive, what are the key takeaways you want our listener to remember? What are the most important things to keep in mind when we think about child psychopathology?
Well, I think the first and most important thing is that it's complex.
Right.
There's rarely just one single cause for child struggles,
Mm.
and there's no one-size-fits-all solution. It's really about understanding this intricate interplay of, biological, psychological, and social factors that are all contributing to their unique challenges.
And just like no two snowflakes are alike, no two children are alike, their experiences, their strengths, their vulnerabilities, even their responses to treatment will all be different.
Exactly. That's why taking a personalized approach is so crucial. We need to tailor our interventions to really meet the specific needs of each child, taking into account their developmental stage, their personality, their family, their cultural background, all of it.
And we can't forget about the power of prevention either. By fostering resilience and promoting mental health literacy and just creating these supportive environments for all children, we can help prevent a lot of these problems from developing in the first place.
I totally agree. Early identification and intervention are key. The sooner we can identify and address a child's struggles, the better the chances of preventing more serious long-term difficulties. And for those children who are already facing challenges, there is hope. With the right support, with the right treatment, they can overcome those obstacles and live really fulfilling lives.
That's such an important message for our listeners. There is hope, and there are so many people out there who are dedicated to helping children thrive. Okay, so before we sign off, I want to leave our listener with one final thought-provoking question.
Oh, I love those. What is it?
Okay, so if we could design like the ideal system of care for children's mental health, what would it look like? What would be those essential elements to ensure that every child, regardless of their background or the challenges that they're facing, actually has the opportunity to reach their full potential?
That's a fantastic question. It really challenges all of us to think critically about how we can improve the current systems and create a better future for all children.
Well, on that note, thank you so much for joining us on this deep dive into the fascinating and honestly really important world of child psychopathology. It's been such a pleasure exploring these complex issues with you.
The pleasure was all mine. Thanks for having me.
And to our listeners, thank you for your curiosity and your commitment to really understanding the intricate workings of the developing mind. We hope you'll continue to learn and explore this field. Until next time, keep diving deep.